what I have been taking nowadays in general surgery. Today's video of the discussion is about lower limb ischemia. So, as the word, firstly, before getting into the detailed discussion for lower limb ischemia, we need to be very well aware what is the literal meaning of the word ischemia. So, wherever the word ischemia is being used, the word itself indicates that there is going to be a decreased blood supply to a particular organ, and since if a decreased blood supply to a particular organ is there, the organ is going to be deprived of its oxygen supply, and this oxygen deprivation is going to cause the necrosis and the gangrene of that particular tissue. So when we talk of lower limb ischemia, it refers to the decrease in the oxygen supply of the decrease in the blood supply to a particular organ, and this particular organ, if it is lower limb, it is called as lower limb ischemia. So when we talk of lower limb ischemia, see, majority, whenever we must have heard, we are very well familiar that must we must be very well coming across this kind of a terminology, that myocardial ischemia. So whenever it is a case of myocardial ischemia, what it is there that the patients become very well aware, because myocardial ischemia, the word itself is telling that there is decreased blood supply to the heart. So when the heart muscles are starved of oxygen, when the heart muscles are starved of oxygen and blood supply, there is going to be a pain in that chest, and that pain is called as angina. So because of angina, this kind of a pain is present, and parents and the patients, they are very well acquainted of this. They are very well aware of this myocardial ischemia, and they seek the necessary medical attention at the very right time. But if it is the case of lower limb ischemia, so in cases of lower limb ischemia, most of the patients, they do not take care well of it, and they are not conscious of it at an early age. Mostly whenever the patients of lower limb ischemia are there, they report to the clinic, they report to the hospital very late, and this causes a great financial, social, as well as psychological burden to the patient and his relatives. So um, this lower limb ischemia, although it is a very benign condition, but it can lead to serious medical complications if it is not diagnosed and treated at an early stage. So when we look at the causes of lower limb ischemia, this lower limb ischemia can be broadly subdivided into two broad categories. First, it is the chronic lower limb ischemia, and next it is the acute lower limb ischemia. So when we look at the causes for chronic lower limb ischemia, so chronic means there is going to be a decreased blood supply to a particular limb, and particularly if it is the video is mainly focusing upon the lower limb. So if it is a chronic lower limb ischemia, the causes can be atherosclerosis, where the blood vessel is going to um, lose its elasticity, and there is high lipid deposition within the blood vessel lining. Apart from them, if it is next, it is the thromboangiitis obliterans in conditions in collagen vascular disorder, where the blood vessel is going to lose its elasticity, and finally in cases of diabetes. So these are the four conditions where chronic lower limb ischemia can be precipitated. And when we talk of acute lower limb ischemia, it is mostly seen in cases of acute embolism. So if it is a solid gas or a liquid emboli in the bloodstream, in the blood vessel, and this acute embolism is going to cause a decreased blood supply to the limb, to the lower limb, for a shorter duration of time. In cases of trauma to the vessel, if a particular trauma has been inflicted to a blood vessel, for a shorter duration of time, the blood vessel is going to be impaired of the blood supply, as well as in cases of aneurysm, where there is an abnormal dilatation of the blood vessels. So these are the causes of the lower limb ischemia. If it is a chronic one, it has to be atherosclerosis, it can be thromboangiitis obliterans, it can be certain collagen vascular disorders, what is going to cause the loss of the elasticity of the blood vessels. Whereas when we consider of acute lower limb ischemia, for a short duration of time, the blood vessel is going to suffer from an embolism, or it is a trauma to the vessel which can impair the blood supply to the lower limb, or it can be certain forms of aneurysms. So these were the causes of lower limb ischemia. And when we look at the certain rare causes of lower limb ischemia, of which I'll not get into much detail, so certain rare causes of lower limb ischemia can be in the form of popliteal entrapment syndrome, it can be cystic medial degeneration. So one should not forget that diabetes is also one of the common causes of peripheral vascular disease in elderly patients. All right, now moving on to the next very important terminology, that it is collateral circulation. So do remember, I would like to emphasize on this collateral circulation, because in cases of ischemia, whenever there is a decreased blood supply to a particular organ, what do we find is, when the main blood vessel, when the main artery is having certain kind of a trouble, it is having certain kind of an difficulty in providing the blood supply to that particular organ, our body has a tendency to form collaterals. Means these collaterals, they are accessory vessels, they are going to be developed. And apart from the main vessel, if the main vessel is getting occluded, if the main vessel is unable to supply to that particular organ, these collaterals develop and they supply to that body organ. So when we talk of collateral circulation, so collateral circulation is present in most of the body organs. In most of the body organs it is present, and hence even if a major vessel is getting obliterated, it is getting occluded, the organ can still survive. So if an organ is going to still survive, provided that the collaterals are well developed. So if the collaterals are well developed, the oxygen supply, the blood supply to that particular organ is maintained, and that particular organ can survive for a longer time. So hence, if it is a case of chronic ischemia, so if it is a chronic ischemia, the blood vessel is going to lose its elasticity. It can be one of the reason. The next reason is that it can be formation of an atheromatous plaque. So if it is an atheromatous plaque which is getting formed, so that is also going to impair the blood supply to that particular organ. So if it is a chronic ischemia, which can be seen in the cases of thromboangiitis obliterans, atherosclerosis, it allows sufficient time for the blood, for the formation of collaterals to develop. In cases of chronic ischemia, there is ample amount of time for the body to form collaterals, and that leads to, that actually helps out in that, in cases of chronic ischemia, there is going to be no gangrene, since the blood supply is being maintained by the formation of collateral vessels. Whereas when we talk of, so in cases of chronic ischemia, necrosis and gangrene which occurs is minimized, and thus limbs, they often survive. Apart from this, on the contrary, if we talk of acute ischemia, so in cases of acute ischemia, which is caused by a thrombus, of a sudden formation of an embolus in the blood vessel, if a thrombus develops in the blood vessel, or an embolism is there, so there is no time for the formation of collaterals to develop, and this results in the gangrene of the limb in untreated cases. So this is the condition where the collateral circulation, so this is a very important concept. So in chronic cases of ischemia, the collateral vessels, they have ample amount of time to get developed, but in cases of acute ischemia, so there is as such no formation of collaterals in this condition, and that leads to the, for that leads to the necrosis and the gangrene of that particular limb. Now, when we look at the clinical examination, so this all we have discussed about the lower limb ischemia, the chronic lower limb ischemia, and the acute lower limb ischemia. So when looking at the clinical examination, so the patients who are reporting to the OPD, to when they report to the hospital, it's very late, because this ischemia, mostly it is neglected and ignored by the patients. So when looking at the clinical examination, when we look at the symptoms of it, it is mostly seen. See, whenever there is going to, if it is a myocardial ischemia, there's going to be a decreased blood supply to the heart, so the heart muscles are getting deprived of the oxygen and the blood supply, and a chest pain is elicited. Similarly, in cases of lower limb ischemia, if there is a decreased blood supply to the lower limb, there is going to be presence of a pain. So this pain is going to be elicited, and thus the nature of the pain, where the patients mostly tell, it is a severe cramp like pain due to ischemia of the muscles. Since there is a decreased blood supply to the muscles, so mostly the pain what is seen, it is a cramp like pain. So this cramp like of a pain is seen, and pain is mostly seen on exertion. Do remember that whatever the patients of lower limb, if it is a pain in the lower limbs due to lower limb ischemia, mostly the pain what is there, the pain, the aggravating factor of pain, it is exertion. So whenever the patients are having any kind of an exertion, when it is a walking for a longer distance, or any kind of a physical activity of exertion what they do, the pain is greatly enhanced, it is increased, and that leads to, in medical terminology we call it as intermittent claudication. Apart from them, when we talk of the rest pain, so most of the patients when they come to the clinic, they mostly say that during the periods of rest there is an intractable type of a pain, usually in the foot and the toes, etc. Apart from them, this type of a rest pain, it is an indication of severe ischemia of the foot with impending gangrene. So impending gangrene can occur if it is a rest pain, because rest pain is clearly indicating that there is a severe ischemia, and if it is a severe ischemia, there has to be gangrene and necrosis of that particular tissue. If it is a lower limb ischemia case, mostly the gangrene is seen in the distal parts of the toe, the distal part of the feet. This gangrene is going to take place, and the rest pain, most of the patients they do complain that this rest pain is going to worsen at night, because at night mostly the patients are going to lie down, and during the lying down condition this pain is going to worsen. All right. Apart from them, when we look at the healing ulcers, what kind of ulcers are mostly seen? So, in the cases of lower limb ischemia, what is mostly seen, that the ulcers what develops in the distal part of the toe, in distal part of the foot, tip of the toes, these ischemic ulcers, because due to decreased blood supply it is there, these ischemic ulcers, they are very deep and they are very painful as well. So sometimes some patients they do complain of gangrenous patches of skin and subcutaneous tissue, and gangrene also affects the distal parts of the toes as well. However, gangrene is minimal because of collateral development. If it is a case of chronic lower limb ischemia, obviously, as I've already said, that there is going to develop the collateral vessels. So, in cases where there is an ample time for the development of the collateral vessels, so there is minimization of gangrene and necrosis. And apart from these common symptoms what are the patients are going to present, apart from them, the symptoms what is mostly manifested, it is in the form of coldness, it can be in the form of numbness, it can be in the form of paresthesia, where a kind of a tingling sensation is present, and also about the color changes what is seen in chronic ischemia. So one must remember this fact, that majority of the patients of the peripheral vascular disease are chronic smokers. They are smokers. So students and viewers, this was a very short discussion where I've tried my level best to simplify the fact, the concept of the lower limb ischemia, the causes of it, the types of the lower limb ischemia, and the clinical examination. Students and viewers, if you still have any queries or comments, you're most welcome to comment me in the comment section. And students, if you want certain topics that you want to and you certain topics I need to discuss for you, you're most welcome to comment me in the comment section. Viewers who are new to my channel and they haven't subscribed yet, go do subscribe my channel, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. Thank you for watching.